Good morning, everyone. Welcome back into North Dakota today. For many, there's nothing like a road trip in the height of summer, but men over 45 experiencing urgent or frequent urinary symptoms may prefer to stay parked. Dr. David Wilkinson is joining us now to talk about how to get men out of the restroom and back into the driver's seat. Good morning.
Good morning. How are you?
I'm well. How are you doing?
I'm doing great. Thank you for having me.
Yes, of course. It's such a pertinent issue for so many people. So, Dr. Wilkinson, what are we really talking about today?
So we're talking about a condition that affects 43 million men called BPH, or benign prostatic hyperplasia. Essentially, that's overgrowth of normal cells in the prostate. During that process, the urine channel that runs through the prostate becomes narrow. It causes our bladders to work harder to push urine past that, and we develop symptoms like going frequently, having to go urgently, getting up more at night to urinate. In a survey that we did of summer travelers, 43% of men who responded told us that their travel would be affected by bathroom breaks. 33% said that they don't enjoy road trips like they used to. Mm-hmm. And 25% of men actually said that they plan their trips based on knowing where bathrooms are. They plan their route knowing where the bathrooms that they can stop for a pit stop are. So when we start to have symptoms that affect our lifestyle and our sleep patterns, this is when we need to intervene. This is when we need to seek care.
Definitely. It sounds like it's really affecting these people's quality of life.
Definitively.
Mm-hmm.
And again, it's not just a convenience thing. It's you're at work and you're on a Zoom meeting and you're wondering if you're going to make it through the meeting. It's getting up 3 or 4 times a night to go and having interrupted sleep and not being rested and allowing your body to rest and heal overnight. So it's not just a convenience thing. Also, if this is left untreated long enough, we can actually have permanent damage done to the bladder.
Mm-hmm. So if this sounds like you at home, maybe you're interested in finding a solution, how can people really cure themselves or find a solution to this?
So in the past, we've used medications quite a bit. Medications, for me, they treat the symptoms, but they don't solve the problem. Mm-hmm. Medications also carry a risk of side effects. The medications we use for this condition also can cause cardiac failure long-term, and there's now a concern for risk of dementia. So we now have a minimally invasive treatment that's proven called the UroLift system, and it's been around for 10 years. We've treated 425,000 men worldwide. It can be done outpatient, even in an office. Most patients do not require a catheter after the procedure. If they do, it's overnight. Rapid relief of symptoms, back to work sooner, and it's the only procedure that we do to open the prostate that has zero risk of sexual side effects.
Wow, so this is really something that you would recommend if you are experiencing these symptoms to nip it in the bud?
Absolutely. Waiting and writing this off to this is a normal part of aging are not good things in this case. We want to prevent damage to your bladder long term, and we can do that in a way that is not disruptive to your lifestyle, that is not disruptive and in your work cycle. We have a very good, proven, minimally invasive treatment that can take care of these symptoms without even having to use medications. So if you're experiencing these symptoms, I would recommend that you go to www.urolift.com. That's UROLIFT.com. You can fill out a score and rate your urinary symptoms. And you can use our physician finder to find a urologist in your area who does this procedure. Schedule an appointment, discuss your bathroom breaks and the potential of the UroLift system treating these symptoms for you.
Absolutely. Well, thank you so much for this crucial information. We really appreciate it.
I enjoyed our time and thank you for having me.
Of course. Thank you so much. Coming up on today's show, we have more of the Moorhead Indoor Summer Vendor Show coming up.